My name is Acadia Buro, and my talk is on formative research to inform the development of behavioral interventions for adolescent and young adult cancer survivors. Adolescent and young adult, or AYA cancer survivors, have an increased risk of obesity-related chronic diseases, including diabetes and cardiovascular disease. So weight management is helpful to improve prognosis in this population, but despite multidisciplinary recommendations for healthy dietary patterns and weekly physical activity levels for these survivors, they tend to exhibit low physical activity levels and poor adherence to dietary guidelines. Moreover, they exhibit a variety of age-dependent transitions and stressors, including but not limited to strained relationships, financial concerns, independent living challenges. And so we know that stress may impact ability to participate or engage in healthy lifestyle behaviors in the general population, but there's a lack of work looking at this specifically in AYA survivors to see what that looks like. So in conclusion, health behavior interventions for these survivors may address these psychosocial needs by including a stress management, mindful eating, or other mind-body component, but our qualitative findings at least suggest that they may be tailored for a more specific age group than 18 to 39 to account for differences in stress experiences and intervention preferences. But of course, further research, including direct measures, is warranted.
Hello, my name is Kristin Cloyes. My pronouns are she and they, and thank you for being here today. I appreciate it. So I'm going to do something a little bit different. Rather than presenting the results of a single study, I'm going to be sharing insights that I've gleaned across more than a decade of doing research with sexual and gender minority populations and groups. We've just really put together a set of lessons to increase inclusion of sexual and gender minority participants in cancer intervention work, and so that's what I want to share with you today. Where are we right now? We've well established in the literature that sexual and gender minority groups do experience cancer-related disparities, disproportionate burden from cancer, disproportionately negative health outcomes, and the need for this research has also been very well established in the literature. We've also seen, I would say within the last 10 years for sure, but certainly the last 5 years, a real proliferation in the amount of competency training resources. A lot of those are focused on clinical competency for people that are delivering clinical care. There's still a gap in terms of research competency, but there's some really exciting work happening right now. I also have a QR code at the end with references and resources. Some of the things that are still continuing that are not as exciting is we still have a lack of systematic routine sexual orientation and gender identity collection. So it makes it really hard to track cancer outcomes for sexual and gender minority groups. Also, although we have a real bolus of literature, recently, a lot of that literature continues to be secondary analysis of survey data, which is really important and definitely moves the needle forward. We also have a lot of systematic and scoping reviews, also important, but we still have a gap in terms of prospective, longitudinal, empirical, primary data studies, and we'd like to see an increase in that.
Okay. So my name is Marilyn Stern. I'm at University of South Florida, and I'm going to very quickly talk to you a little bit about a randomized controlled trial that we are running across quite a few different pediatric oncology clinics. I'm going to quickly tell you a little bit about, the rationale for our Nourish T Plus intervention, primarily just briefly talking about some initial findings that will hopefully give a context for some of the things that we do in terms of working with Spanish-speaking families. Nourish T stands for Nourishing Our Understanding of Role Modeling to Improve Support and Healthy Transitions. What we mean here by healthy transitions is moving from active treatment to survivorship. And so that is our focus, and our eligibility criteria for the project is over 6 months off active treatment. Although most of the kids that get referred to us and are part of the project are about 2 years off treatment.